That's two.
That's 5 minutes starting.
Candidate 1, 2, 3. Have you read and understood the Viva?
Yes.
Can you tell me what are your immediate priorities on the trauma team upon receiving this patient?
So this is an emergency situation where we have a firefighter who's probably sustained burns, may have a lung injury secondary to burns, and probably has a crush injury as well due to being trapped under a tree. He's tachycardic, hypotensive and confused, which makes me wonder whether he also has a head injury, whether there's carbon monoxide poisoning, and he's also been administered some morphine, which may be contributing or masking potential other injuries and confusion. So the priorities of the trauma team upon receiving the patient are to simultaneously assess and resuscitate the patient, ensure that adequate resources have been summoned into the hospital to deal with this situation in a team-based scenario. EMST protocols should be followed according to airway, breathing, circulation, disability and secondary exposure and evaluation. And given this is a tertiary referral hospital, I would also consider alerting the nearest burn centre that the patient may need to be transferred there.
Okay. So in terms of your ATLS protocol, you just mentioned that sort of, well, first, what's your first priority in terms of the ATLS protocol?
Obviously airway.
Yep, and what do you see as possible difficulties with this patient?
So the possible difficulties with this patient is he's confused. He may be thrashing around, non-compliant. Getting intravenous access may also be difficult, given that he's got burns, and given that he is also tachycardic and hypotensive, he's probably in a degree of shock. So getting peripheral intravenous access may also be difficult as well.
Okay, so he's very difficult to manage. You're unable to assess him appropriately, and you as the team decide that you are going to intubate this patient. How are you going to approach that, and what drugs are you going to give? And tell me about your intubation plan for this patient.
So, in this patient with burns, I'd be cautious. I'd actually be trying to avoid the use of succinylmethonium, given that he may well be hypokalemic, and also because of the crush injury. I would do a rapid sequence induction. Once intravenous access has been obtained, I would use a combination, or it's actually a modified rapid sequence induction using propofol, rocuronium with sugammadex on hand should I need to reverse him. I would use a 4-Mac blade with a pre-bent bougie in case I have a grade 3 view.
Okay. You also mentioned sort of carbon monoxide poisoning.
Yes.
Can you tell me about other signs or clinically signs that you might have to suspect an inhalational injury?
So the clinical signs of an inhalational injury, it mentions here that he has burns on the face. So I would be inspecting the oral mucosa to see if there's soot in the mouth. I would be looking at also soot around the nose. Other signs could be, so in terms of carbon monoxide poisoning, it's hard because they do appear very pink in my experience, so it's hard to tell. You won't be able to see whether they're actually hypoxic because they won't be blue.
Okay. You also mentioned that you were concerned about a traumatic brain injury. How do you classify and assess a patient with a traumatic brain injury?
So a traumatic brain, so the way I would classify it is you have an open head injury or a closed head injury. In this case, it's probably a closed head injury. I can't recall how I would classify it, but I'd get a CT of his head.
Sure. Can you tell me about the components that you use to make up the Glasgow Coma scale?
So Glasgow Coma scale is a 15-point scale, which is composed of eyes, so opening eyes spontaneously, eyes to voice, eyes to painful stimulus, or not opening eyes. There's prompts for movement, and that's a 6-point scale, and verbal is 5.
Okay. Also, sort of working down your list of priorities in your ATLS protocol, you mentioned that you're concerned that this patient may have been in shock. Can you tell me about how you would assess his level of blood loss at this point in time, or if you're concerned about blood loss?
So I am concerned about blood loss. He may well have intra-abdominal bleeding, given that he was crushed. 5 minutes.
Pretty tough.
But that's what it is. I mean,